So, what causes head pain, migraines, facial pain, jaw pain, ear ringing, neck pain, ghost toothaches, dizziness, and some of these other symptoms? Since the underlying issue is the same, we will encompass all of these problems as one category called head pain from this point forward. Head pain is a result of an imbalance and muscle tension, which leads to abnormal nerve and blood flow changes to your head. It can also lead to a breakdown of the jaw cartilage. Some of these symptoms may also be a result of neck dysfunction problems, such as bulging or herniated discs, degeneration, or trauma caused by car accidents or other such problems. In this video, we will give you the proper treatment methods in order to help you get back to a pain-free lifestyle. So, where do imbalance and tension come from, and what do they cause? First, you must understand the basic anatomy of the head and neck. The head is made up of your skull bone, your lower jaw, and your neck. Your head sits on top of your spinal column. The skull bone consists of several bones that are fused together. The upper jaw is attached to your skull bone. You cannot move your upper jaw despite common belief that you can move it side to side. If I tell you to move your upper jaw to the right, you instinctively will falsely believe that you can do so, when in fact you are actually moving your lower jaw to the left. The lower jaw is attached to your skull bone by means of several large muscles. If you remove the muscles from the lower jaw, it falls off. You can move your lower jaw by opening, closing, going side to side, backward and forward. There are over 300 muscles that attach and control the function of your head. To understand how muscles themselves work, let's take a comparison between your lower arm and your lower jaw. Let's pretend that we are lifting something off of the ground and bringing it up towards us. When we do this, we are contracting the bicep muscle. You see, muscles know how to do one and only one thing. They contract in order to cause motion. This is similar to your lower jaw. In order to close it, you must contract the strong muscles of closure. If you want to put something back down towards the ground, your bicep muscle will relax and gravity will bring it back down. If you wanted to push the object into some heavy mud, you would engage your tricep muscle on the other side of your arm in order to forcefully push it down. Muscles cannot lengthen, they cannot push. They can only pull by contracting. So, when you move your head to the left side, it is not the right side muscles that push. It is the left side muscles of your neck and shoulders which contract. To bring the head back to normal, your right side muscles of your neck and shoulders would then contract. Now let's take a closer look at the muscles of your head. The largest muscles start with the trapezius, which runs from the base of your skull to your shoulders. Next are the three large muscles of your lower jaw, commonly known as the mandible, which together are the strongest muscles in your body. These are called the closing muscles. There are hundreds of additional smaller muscles that allow you to see, talk, chew, smile, swallow and carry on all of your normal functions. There are only two very small muscles that attach to your lower jaw and allow it to open. They, along with the force of gravity, help you open your mouth. They are approximately 1,000 times weaker than the closing muscles. To understand the difference between the closing and opening muscles, we are going to do a simple test. First, we are going to hold our thumb with mild pressure against the front part of the lower jaw. We are going to open our mouth about a dozen times, trying to gently resist with our thumb. You will notice very quickly how your muscles begin to tire and pain can actually set in. This is due to the fact that these muscles are very weak. Next, we are going to take our fingers and we are going to resist our lower jaw from closing by using our arm with as much pressure as possible. You will see that the closing muscles of your jaw can create over 50 pounds of force and can be even stronger than your arm. It does not get tired to close your jaw. So now you can see that we can generate an enormous amount of pressure when we close the lower jaw. The 300 plus muscles of your head, to a certain extent, work in conjunction with each other to provide the basic functions of your head, from moving your head from side to side, to smiling, talking, chewing, drinking, and carrying out all your other functions. The lower jawbone has a bony extension called the condyle, which is covered by a thick piece of cartilage. This cartilage acts like a brake pad in that it protects the jaw joint, as well as the underside of the skull bone and the brain tissue and ear areas from the effects of the lower jaw closing together. The lower jaw has a bony extension called the condyle, which is covered by a thick piece of cartilage. This cartilage acts like a brake pad in that it protects the jaw joint and the underside of the skull bone, as well as the ear areas, from the effects of the lower jaw closing together. If you look at the inside of the skull bone, you can actually see how thin the skull bone is in the area of the cartilage. It can be as thin as 1/16 of an inch and no more than 1/4 of an inch in thickness. It is important to remember why the cartilage is so critical in helping to protect this delicate and thin area of your skull bone and your brain tissue. Next, you must understand how your jaws, muscles, teeth, and cartilage work together in order to provide you with the ability to chew, smile, talk, etc. The pressure of the jawbone gets transmitted as pain to the brain. Subsequently, the bad jaw position in the abnormal muscle function causes compression of the arteries and subsequent blood flow changes to the brain itself. Next, you must understand the function of the nerves of the head. The two largest nerves in your body are located actually in the jaw area. The trigeminal and facial nerves work together to control the function of all of the muscles and structures of your jaws and face. The brain tells these nerves to make your muscles work. The brain also receives feedback sensation from these nerves. So these nerves tell your muscles how to bite, and they also tell your brain when you like a burger or when your coffee is too hot. The trigeminal nerve provides feelings and function to your eyes, sinuses, gums, teeth, tongue, lips, and jaws. More importantly, it actually controls the blood flow to the brain. It is the most complex nerve in your body. The trigeminal and facial nerves are affected by the muscles and the jaw joint because they get compressed. They get squeezed by the muscles and the jaw joint. As they get irritated and squeezed by the dysfunction of the muscles of the jaws, they start to cause an imbalance in the blood flow to the brain, as well as other neurologic issues. Some of these issues can be anything from a ghost toothache to a burning tongue, sinus pain, ringing in the ears, and most commonly, migraines. Research shows that over 30% of the nerve impulses to the rest of your body pass near or through the jaw joint area. Over 25% of the body's total nerves actually go to your jaws and your face. Couple these facts together, and you can see how this problem can affect up to 50% of your entire health. There is one basic law of nature that pertains to your teeth and jaws. Your teeth should never come together, not even when you are chewing your food. That is right. When you chew your food, there should always be food between your teeth. Rarely, such as when you chew lettuce, do the teeth ever come all the way together. What one must understand is some basic physiology. In patients who have head pain, there is a common fault. The patient overcloses or causes the jaws to close together too much. This is commonly seen in patients who chew gum, clench, grind, or chew hard foods. Stress can lead to abnormal grinding and clenching of the teeth, while at the same time, a jaw imbalance issue, such as an overbite or bad bite, can cause the stress that leads to grinding, clenching, and subsequently nerve and blood flow dysfunction, which ultimately causes the head pain. Which patients are more likely to experience these problems? This can be easily seen in patients who have deep overbites and poor bites. What this means is that any bite issue reduces the effectiveness of the teeth to hold the jaws in the proper position. For example, a patient with an overbite has a small lower jaw with short teeth. This jaw has a hard time finding a proper chewing or rest position. This imbalance can cause abnormal muscle and nerve function and can lead to wearing down of the cartilage, since the cartilage has now become the main brake pad. You may say, so what? Well, the problem with head pain is that it starts once you have used up your allowance of biting your teeth together. Some statistics show that the average human actually bites their teeth together over 7,000 times a day. Someone who grinds or clenches does so over 10,000 times a day, including sleeping. This may not seem like a problem until the jaw joint starts to wear out and your muscles begin to spasm. The jaw joint cartilage is similar to a brake pad on your car. Think about pushing the brake on your car 7,000 times a day. You would need new brakes in just a few weeks. Consider that the jaw joint cartilage is not made up to hold to the constant braking. It will start to wear down rather quickly and to the point that there may be none left. Now, the rate at which this cartilage breaks down is usually parallel to the amount of pain that one experiences. For example, in migraine patients, we see a severe breakdown of this cartilage. So, in conclusion, take a look at your jaw alignment by observing whether you have an overbite, missing teeth, crooked teeth, or if you have a history of orthodontic care or trauma to your head and neck. Consider whether you are a chronic clencher or bruxer. Consider whether you chew food excessively or chew gum excessively.